Different varieties of rice. There are over 40,000 varieties of rice, which means that there are many different types to choose from. Some of the most popular ones include brown rice, also known as whole grain, white rice, and basmati rice. 1. Brown rice. Brown rice is healthier than other varieties because it contains more nutrients like fiber, protein, vitamins A, E, and B12, iron, magnesium, zinc, and much more vitamins and minerals. Brown rice is better for diabetics because it has a lower glycemic index than white rice. Brown rice also contains phytonutrients, natural chemicals found in plants, which can be beneficial for people with diabetes by helping to control blood glucose levels and reduce insulin resistance. 2. White rice. White rice is the most commonly eaten type of rice. It's high in carbohydrates and low in fiber, so it can cause spikes in blood sugar levels for those with diabetes. Therefore, it's recommended to keep white rice consumption to a minimum and replace white rice with a more healthy whole grains option. 3. Whole grain basmati rice. This variety has a nutty flavor and rich fragrance that comes from being aged at least 6 months before milling, grinding into flour. It's often used as part of Indian dishes such as biryani or pilafs because basmati rice cooks quickly due to its thin grain size. The grains are long enough that when cooked properly they won't stick together like other varieties might do if overcooked, which means less mess on your plate. Brown basmati also contains antioxidants called polyphenols that may help lower cholesterol levels. Whole grain basmati rice is also a better option for diabetics because it has a low glycemic index. 4. Black rice. Black rice is a whole grain that's high in fiber and has a low glycemic index. It also contains antioxidants, which makes it a healthy choice for people with diabetes. 5. Wild rice. This type of rice is actually not rice at all, but the seed of aquatic grass. It's high in protein, fiber, and minerals like zinc and magnesium. However, it has a high glycemic index, so you'll want to avoid it if you have diabetes. 6. Sticky rice. Sticky rice is made from glutinous, starchy rice flour and is often used in desserts or dishes that are served as part of the main course. It's very high in carbohydrates and calories, so you'll want to avoid this variety. 7. Arborio rice, risotto. Arborio rice is a type of Italian white rice that's often used in dishes like risotto. It has a high glycemic index, so you'll want to avoid it if you have diabetes. Other rice grains. There are other options that can be used instead of rice. They contain more protein than white or brown varieties, so they may help keep you full for longer. There's no reason to avoid these grains if you have diabetes as well. 1. Quinoa. This Andean grain is actually a seed, but it's cooked like a grain. Quinoa is gluten-free and has a low glycemic index. It's also high in fiber, protein, and minerals like magnesium and zinc. 2. Bulgur. Bulgur is made from whole wheat kernels that have been boiled, dried, and cracked into small pieces. Bulgur has a low glycemic index and is high in fiber, protein, and minerals like magnesium and zinc. 3. Pearl barley. Pearl barley is made from whole grain barley kernels that have been polished off their outer bran layer. They're high in fiber and protein, with a low glycemic index. 4. Amaranth. Amaranth is a gluten-free seed that's often used as a grain. It has a high protein content and a low glycemic index. How to cook rice. There are many different ways to cook rice, but the most popular one is by boiling it in water. Here's how you do it. Rinse the rice in cold water until the water runs clear. Add the rice to a pot and cover it with twice as much water as the rice. Bring to a boil over high heat, then reduce the heat to medium-low and simmer for 15 minutes. Remove from heat and let sit for another 5 minutes before fluffing with a fork. Cooked white basmati rice will have a slightly sticky texture while brown basmati will be fluffy. If you're looking for something more savory, add some herbs like rosemary or thyme to the cooking water before boiling. Another way to have cooked rice is by using a rice cooker. Just add the desired amount of rice and water, press the button, and let it do its thing. A good thing about cooking rice slowly is that it lowers the GI. Instead of a pressure cooker, use a pan and add more water. Conclusion. If you're looking for rice that is low in carbs and high in nutrients, brown basmati rice may be the best option. Brown basmati has a lower glycemic index than white or wild varieties of rice, so it's better for those with diabetes as well. Wild rice also has fewer carbohydrates than other types of rice such as arborio, which can make it useful to diabetics who want something more savory than plain white or brown variety. If you need help deciding what type of rice would work best for your meal plan, talk to your dietitian about what the best options are for your diet.